Lindsay from Slate also here as one of the sponsors along with Optima HR, Steve Shedd and Dave Hardy from Concilium Plus. And we have been kind of working with Linda from the Delano Chamber of Commerce for the last few weeks to put together this seminar because we feel that there are a couple of really important topics coming up for next year that everyone kind of needs to know about. So thank you to Linda from my chamber, from the Delano Chamber of Commerce, as well as Sue and Melissa from the Buffalo Area Chamber of Commerce, and for Deb Mayer from the Monticello Chamber, and from Missy from the Wright County Economic Development Partnership. What's that?
And Mindy.
And Mindy as well. Yeah, thank you to all of you for the work that you've done to put this together. So we know that there are a couple of really important topics that are coming up as of January of next year. One being the Paid Family Medical Leave or Paid Leave Act that's going into effect in January, as well as this Secure Choice Retirement Act, which is also coming up, and it's maybe a lesser known one. So we've got some folks here today to talk about that. And then you know, we understand that it's important to understand the mandates, but also how they're being enacted and the kind of administrative things that are going to come along with that. At Slate, we work with a lot of business owners who we know this is going to impact their businesses. And so, you know, we wanted to put this together to really educate the community about how we can all be well prepared for that. I watched some webinars at the beginning of the year from the state, trying to understand it for my own clients and really realized that there wasn't a lot of like human beings that I could ask questions to. So I went to a seminar that was put on by Midwest Bank with both Optima HR and Concilium Plus there as speakers. And quite frankly, I went just to hear Steve talk about the paid leave portion of it. But then when I heard what Dave had to say about the Retirement Act and what was coming up with that, you know, both Melissa and I looked at each other and thought, how have we not heard of this before? And so both topics we felt were super important to just bring to the business community to really make everyone more aware of it. So that's what we're here to do today, to educate everyone, offer some assistance with the administrative piece of the puzzle if we need that. But mostly we're here for the education and to kind of dispel some of the fear around the expense, the administrative burden, and answer questions. So Steve and I are going to take questions towards the end of kind of the paid leave discussion. I'm here just to kind of talk about the private option that you can do for paid leave and how that kind of corresponds with some of the benefits that you might already have in place. And then Steve's going to talk about the fiduciary responsibility as well before Dave kind of takes the floor. So with that, I will turn it over to Steve Shedd from Optima HR, and thanks everybody for being here.
So I'm Steve Shedd. I started Optima HR Solutions in 2017. I had spent my first part of my career doing a lot of different organizational work, mostly strategy work. And my last job was with Andersen Windows over in Bayport and Stillwater. And my role there was an HR business partner. And so when I left Andersen and set up Optima, my goal was to really bring some of the good HR stuff that we had in a large corporation like that to small businesses, because face it, small companies are competing for the same talent that Andersen Windows competes for. And so they've got deep pockets and lots of resources. And so the idea was to try to bring some of that capability to smaller businesses in bite-sized chunks that fit well with what you have in terms of your cost constraints and your capacity to be able to do things, but really do it in a way that you can kind of get the best of those best practices without necessarily making a full investment. So we talk about fractional. It's just kind of a word that we grabbed onto that we discovered in the marketplace. We were placing CHROs in small companies on a part-time basis. So you get a fraction of a person who can help work with your leadership team on more the strategy of the business and the talent strategy that supports and enables that. And then since then, we've added other support such as outsourcing. So we can serve as your full HR department. We can partial outsource. We can kind of fold in around whatever HR resources that you have, try to tailor a solution for the client that we have. And then we have consulting and tech services as well. So that's us in a nutshell. So this topic has, it's really an interesting time. So there's a bunch of things that are converging, especially in Minnesota, but it's happening in other states in the country too, that are, I think a lot of businesses aren't quite ready for it yet. And so it's good that you're here. You probably have attended webinars that have been put on by the state and others. The perspective I want to bring to this discussion around paid leave is some of the operational things that you're going to have to be thinking about. Because the devil is always in the details, right? So we understand the headlines, we're being taxed to provide paid leave for employees. But when you start to peel back the onion in terms of what does that mean operationally, there are some things that you have to start doing today in order to be ready for when the program goes into effect in January. And that's when I want to help you get prepared for. So there's a lot of detail over the next hour and a half. And so it's, after a while, you're going to feel numb. So I'm going to try not to spend too much time on the details. I might dive deep on a couple of things and explore it a little bit with you, but there's a lot of information in the slides. And I believe people are going to get the slides afterwards. Is that correct? Or a PDF of them? So you'll have this information to refer to. So don't worry if you don't capture every note. But I feel your pain sitting in the audience when you're going to go through this level of detail. My background is more strategy, so I'm not a compliance guru. I have people on my team who are really smart and they know this stuff inside and out. One team member in particular has been studying it since it was passed. So she's been helping us pull together all the resources and templates and really a playbook for how we're going to work with our clients and implementing these programs. So if you have questions or want to tap into our expertise, feel free to give me a call. I've got business cards and we can talk. So I'm going to talk about two things. I'm going to talk about the paid leave, but then I'm also going to talk about health plan fiduciary responsibilities through ERISA that I would say 95% of people I talk to are familiar with the first one, and I would say 5% are aware of the second one. So I'm going to give you a little dip into that when we get through this paid leave, and you might be surprised at what you hear. So Minnesota has been at the forefront of this parental leave thing for quite a while. 87 was when we first passed legislation in this arena, and it predated the FMLA, which most people are aware of. So Minnesota has always been kind of more progressive when it comes to worker-friendly policies. And so the Paid Leave Act was passed in 23. And so this is going into effect on January 1st. Everybody is aware of that. So there are two components to this. There's personal medical leave and then there's family leave. And so the maximum that you can take for either one of those is 12, but you could take a combined leave of up to 20 weeks per benefit year. And so the benefit year starts under the state plan, the first day of the leave and is measured forward. So once they take leave, then a year goes into effect. So it's kind of on a rolling basis per employee. The initial payroll tax right now is set at 0.88, and that can be split up to 50-50 between the employee and the employer. Most people are aware of these basics. So this is what's covered. So under medical leave, this is going to be for a serious medical condition. And so you're going to have to be able to differentiate between what's a regular time off for a not serious condition versus a serious condition that would qualify somebody for leave. So you're going to have policies that you have to have in place to define that for your employees. And then the family leave covers several different areas. So bonding, this is for new parents who have a child to adopt. There's some nuances within there. Caring for a family member with a serious health condition, personal safety. So people who are in a domestic abuse situation where they need to maybe get away to have safety. And then active duty. So supporting people who have a family member who are on active duty and they need to care for things at home. So that kind of covers the waterfront of the situations at a high level. So employer responsibilities, payroll deductions are going to start in January. And the first premiums are going to be due on April 30th. So the quarterly premiums will be due for that first quarter then. Wage reporting started last year. So if you haven't been doing that, it's happening automatically. So if you have an unemployment insurance account, that reporting is happening automatically. But there are some situations where there are people that should be reporting that aren't. Usually those are owners of businesses. And if you're an owner that owns more than 25% of a business and you're drawing wages from the business, but not paying unemployment, that person's hours need to get into the system. So you can set up a separate tracking account for those types of individuals. That's just one example, but you're going to want to pay attention to that if you haven't done it. So that's where the leave only account comes in. I just talked about the LLC. Employee notifications. So you're going to be responsible for conveying this information to your employee base no later than or by December 1st. And so what that means is you're going to have a communications plan built in order to get the information to your employees. The other piece is you're going to want to make sure that your managers are trained on this, because they're going to be on the front lines of people saying, hey, I want to take leave. And so they need to know how to respond and what your processes are. So you're going to want to be thinking ahead about all these communication pieces that have to be layered in before December 1st. And then policy updates. This one is where some of the complexity is going to come in, because you're going to need to look at all of your leave policies, including PTO, ESST, short-term disability, and think about how all those things are going to fit together. And we're going to talk about why you have to do that in a little bit. But so these are some of the things that you're going to need to kind of have as your plan of action between now and the end of the year. So for self-employed and independent contractors, they can opt into the program. So if I wanted to have a little bit of a paid leave as an independent contractor, I can pay my premiums into the program and get that leave off. So this is really intended for wage replacement. So as somebody goes out on leave, which they're entitled to now under FMLA, this is another overlay where now they can get compensated. And they use this term wage replacement. That's the idea, is to replace the wages that they would otherwise lose when they go out on leave. So this is all built into formulas that are built around the average weekly wage. And so you can see some of the numbers on here, and there is a maximum that is set per week on what can be distributed to that individual. And as you think about your more highly compensated people in the organization, that number is probably going to be a fraction of what they get paid on a normal basis. This is where you as an employer have to think about your culture and your values and what you want to do for your employees. And it may be that that's the limit and that's the deal. There are ways that you can increase that amount with other levers so that you can make people closer to whole as they're taking time off in the business. So that's where you're going to want to think about how you want to do it. Ticket workers, that is used to calculate the wage replacement benefit. I'm not going to read through all of these. Remote workers, you're going to want to be clear on who's working in the state of Minnesota for how much time. And if they're working in the state for more than 50%, for at least 50% of their time in Minnesota, or reside in Minnesota without working 50%, they are covered by this. So you're gonna have to figure that out. And as people kind of come and go, this whole remote work situation can create another level of complexity to this and managing the people. This is where your technology comes into place to be able to really understand kind of how many hours are being spent where, so that you can track people and know who qualifies. So here's a basic step for calculating a benefit. So you got step 1 through 4, right? The employee's portion of the wages, 50% or less of SAW. So you calculate it in the way that it's up here. I'm not going to go through this, but this is, you can use this later to figure out, okay, what is the benefit that somebody's going to receive? So if they're under that maximum that's on there, this formula is going to help you to figure out what it is. And what's the average weekly wage is something that fluctuates. And so that's going to be updated periodically by the state. And then that will impact the benefit that people receive in the form of payment as you go forward. So it's, I've got this in another slide, but it's set up in January. And that will ultimately tell us what the final costs of this program are going to be for employers. So the premium rate is, right now it's set at 0.88 of employee wages up to the Social Security tax. So they divided it between medical leave and family leave in the way that you see on here. The potential increase that you see in there, other states that have gone down this path have seen increases. And I would say Minnesota's in a bit of a precarious position because Other states that have done this have pre-funded the plan, meaning they put money into the pot before the program started, and Minnesota hasn't. So on January 1, actually April 30th, money is going to start flowing into the account to be able to pay for the people who are taking leave. And what they don't know is what that rate is going to be. The other states that have gone down this path have been surprised by the cost of it, and so their rates have increased. So there is projections that are saying that the rate may need to increase to 0.92. Other states have seen it over 1.0 in the final calculation, and being able to keep that fund full to be able to cover the employees that are going out. So you're going to want to watch that. Your accountant will probably help you pay attention to that. But your payroll provider is also going to have to be aware of it and using that as how they're figuring out what the premiums need to be paid. So cost sharing, it's back. So the employer must pay at least 50%. And if you're sharing the cost with your employees, that deduction can't cause them to go below minimum wage. So you want to make sure that you're calculating that precisely. And there's a discount for small employers. So that rate that you see up above can be discounted for employers with under 30 people. And so that'll be another layer of calculation that you can look at. That'll be a good benefit for smaller companies. So here's a sample calculation. So this, Emily and I were talking about this. A lot of business people are rightfully concerned about a new tax. It's a pretty modest number at the end of the day. I mean, it's not nothing, right? Every dollar counts. But here's an example of an individual who is making, in the lower left hand, $70,000 a year compensation. And so on a weekly basis, the total leave contributions are $593. So that's for an individual. So multiply that across your workforce. That's going to end up being your weekly ding for what you have to pay for this. Let's see. That's total contribution for the entire thing. There's a calculator on the website, on the state's website, where you can go and play with numbers. And you can enter in your total wages, change the percentage allocation between employee and employer, and figure out what those numbers are going to be so that you can have that built into your system. Questions? I'll just pause for questions. And Emily, if you see anything that you think you should bring up that I haven't, chime in.
No, we'll have them slides to give to everybody after the meeting, and so that link that's in that previous slide, you'll be able to click on that and you can go play around with it. And I highly encourage you to, because it does really help you understand what.
Okay, so this is where now we got to get into some of the complexities of this. I'm going to move this side of the room so you guys don't get too tired of me over there. So remote and multi-state workers. So again, there's that 50% time that you're going to have to be tracking in order to get this accurate. Scheduling and documentation. So intermittent leave is allowed under this, which means I can take time in blocks in order to for the covered reasons. And so you're going to want to be paying attention to how those things are working, but it's operationally, it's going to be a huge scheduling challenge. Right. So now, and the thing is that once this goes into effect, people are going to want to use it. And so it's going to probably create a strain for you at some point. So you're going to want to have plans in place for dealing with people who are now going out on intermittent leave. And people might not have done that under FMLA because they didn't get compensated. Now that they're getting compensated, they may be more likely to take advantage of that benefit. And so that's where in the past, maybe you haven't dealt with it, but maybe you will now. So qualification period is 7 days, and they don't have to be consecutive. So there's a period of time where they will determine qualification, but that doesn't mean that they're not paid during that time. So we'll cover that in the next slide. Any questions or comments on the complexities? What are some of the things that you're anticipating in your businesses? Anything that would add to this?
Well, some of this on here is it's per day, they can't take it per hour, right?
Right. Yeah. Okay, so coordination of benefits is going to be a big deal. So one of the things that you're going to want to make sure is that your policy is clear about how paid leave in Minnesota works with FMLA. Because what you don't want to happen is that somebody takes their 12 weeks under paid leave and then they get more time under FMLA. So you want those to work concurrently so that you don't end up with somebody being out 24 weeks of the year. And then the other thing is, so just kind of differentiating between the two, almost every employee in the state of Minnesota is covered in this. So there's, some people were thinking maybe there were exceptions where you can kind of squeak by. Really, very, very few exceptions are allowed. And then with FMLA, it's different where it's 50+ employees within 75 miles. That's the standard rule for that. The other thing is kind of the employee eligibility. There's some differences there, obviously. And then how much time is allowed. So 12 weeks total under federal FMLA, but you can get 20 under paid leave. So that's another difference that you're going to have worked out in your policies. So concurrency versus stacking, I just addressed that with FMLA. So you're going to want to make sure that you're designating leave appropriately in your system. So as somebody records it, you want to make sure that it gets recorded accurately. Job protection. So if they've been employed for at least 90 calendar days, their job is protected. And of course, retaliation is prohibited. You can't punish somebody for asking for leave. So you gotta be very careful with that and how your managers react, because if you have a stressed out manager on the production line and they're losing a key shop floor worker and they get really ticked off about it, gotta be careful with that. So that's where the manager training comes in. Newly hired employees qualifying under paid leave, they may not be protected from termination under paid leave unless they are also FMLA eligible. So the eligibility for FMLA would apply for job protection in a case where somebody's been in the organization for less than 90 days. The HR people understand that. Tracking systems that are going to be key. So that's the administrative burden that you're going to have to be on top of. Short-term disability. So Emily will be a great resource on this. So obviously, you're probably thinking, well, how does this work with, I've got a short-term disability policy, how does this work? They can work together. So in one way, one thing you have to keep in mind is that paid leave is statutory, so that one is required. STD is voluntary and plan specific. So you're gonna have to look at it and make sure that your plan is adjusted in order to work well with how you're gonna administer paid leave. So you're gonna wanna work with your broker, talk to Emily about how these things can work well together. And what you can do is you've got different waiting periods or qualification period when it comes to paid leave. They might have different duration. Some things that might not qualify under paid leave, like elective surgery. That's not universally true. There are some elective surgeries that would be a serious medical condition, so it could apply. So you're gonna have to understand those nuances, but just understanding how these things fit together is the key from this slide, right? You're gonna want to go back and look at your short-term disability plan to understand this. So the key point here is revise your plans and coordinate, and you can use it to help augment the pay that they receive when they're out. So you could have them work together in that way. So they get some money from the state and some money from your STD. That's an option for you. We'll talk about that more in a little bit. PTO. So again, this is one where you cannot require somebody to use PTO during the waiting period or the qualification period. It's qualification period. Remember that. But it can be used to pop off, right? Get people closer to their full wage when they're out of the office. So, but you can't require the use of it. So think about how, again, this ties back to your culture and how the employee experience that you want your people to have. And so some companies are saying, hey, we're going to make them whole, even though they're at a higher wage, it's going to cost us more money. We're going to use all the tools in our toolkit to make that happen. And you would think, well, why would you do that? That makes them a more attractive employer. So, I mean, they'll promote that in the marketplace if they're doing it. So it can be a competitive edge for attracting and retaining talent. So it's not always just a cost question, because there's other variables that you as an organization want to consider in terms of how it impacts people. Because other people will be looking at this in their own creative ways, and you're going to want to make sure that you can stay competitive, not just on the cost of running the business, but also the employee experience. ESST. So there's some weird stuff happening with ESST, because I talked to the Department of Labor, and because there's a coordination issue here that if I go through the 7-day qualification period and I'm approved for paid leave, I could receive compensation for that first week. And at the same time, I may have also applied, asked for sick and safe time. So you're gonna have to figure out how this is working together. The state, basically, they're pointing at each other. So labor is saying if they ask for ESST, they get it. And the other department that manages paid leave has to figure out how these things coordinate together. Because you could have a situation where people are getting paid twice for a week off. And so that's where you're gonna have to pay particular attention. If you have ESST, if you don't have a PTO plan that meets the requirements for ESST, you're gonna want to look at your policy on ESST and stay tuned for more information on how you can coordinate those benefits. An employee cannot use ESST while receiving, so that's the red right there. So they can't, that's written into it. Employees may use it to cover the qualification period. This is pretty self-evident. Clarify. Okay, train managers. Okay, so here are some of the risks, right? If you have improper leave designation, you could have an issue of stacking. And you might have to have two separate leaves that you don't intend. So that's the one I talked about before, where you're gonna want to make sure that your FMLA and your paid leave work simultaneously. Job protection misunderstandings. So there could be disputes that arise, there could be terminations that happen. This is where you got to make sure that your managers know what the drill is, so they don't get you into hot water. So you're gonna have to pay particular attention to that. Uncoordinated wage replacement, you could overpay, you could underpay people. So you're gonna make sure how these things again work together. PTO policy is not updated. So if you don't do this work ahead of time, it's gonna create confusion when the time comes. So between now and December, when you start communicating with employees, you're gonna wanna have this all worked out. So you should be building a work plan right now that is gonna take you into December to make sure you've got all these things sorted out. Lack of manager training, misstatement of rights, inconsistent treatment. So as with any, I guess, regulation, your managers can, if they're not trained well, they could misunderstand these things and could lead to problems. So here's an example. It's hard to see from here, isn't it? So this is an example. You can look at it when you get the slides, but it's intended to show you how things will work together. So it's talking about, at the top here is paid leave, and then you've got the unpaid parental leave. Then you've got FMLA, short-term disability, and how these things work together to and replace the wage and give time off in the organization. So it's a way that you can start doing some calculations, depending on how much, let's say you want to keep people whole at 90% of their wage. If it's above the maximum that's allowed to pay leave, then you can start to look at these other programs to say, how do I top off or get them closer to that full wage replacement or that 90%, whatever percentage you set, and see how they all work together. So you can look at this slide when you get it as an example, but it's a scenario based on something who's making 100 grand bigger. And it's a nice little sample of how you might do this concurrently.
It's also on the printout, the back side of this printout.
Perfect.
Yeah.
There is the option of applying for a private plan. So you may already be aware of this. So private plan applications need to be equivalent to the state paid leave program. And so you need to submit that for approval with the state. So what that means is carriers through brokers are going to have a plan that is the same as what we have in the state program. So what's happening is the state is going to administer this program for the companies that default onto the state plan. So what that means is an employee's going to pick up the phone, they're going to call the state of Minnesota, they're going to say, I have a condition and I want to take paid leave under the Minnesota paid leave program. And then the state is going to administer that. They're going to collect the documentation that's required. They're going to make a decision and then they'll inform you of that decision. And then you'll take actions from there to make sure that the pay records are updated, that the pay gets issued if you're going to be topping off. Otherwise, they'll receive a payment from the state of Minnesota from the taxes that you pay and the payroll tax that gets applied. So that's generally how it's going to work. So what has been successful in other states is the private market is coming forward and offering essentially an insurance policy where you can purchase it and they'll do the administration for you and they'll handle a lot of the the detail work and make sure that you're in compliance. And this is an opinion, but they're probably going to be acting more on your behalf than the state will. Because the state is, generally, they have a worker-friendly stance. They're going to be true to the law. But a private insurance plan might be a little bit more tilted towards the employer's favor and being stricter on how the rules are applied. Again, this is just my opinion. They're both going to be fine, but there's also some other benefits with private plans where they could be less expensive, depending on your population. And so if you're trying to reduce costs while complying with this program, you're going to want to talk to people like Emily about what plans are available, because they can tell you, they can help you with some actual calculations to see, okay, here's all the numbers are going to shake out. And what am I going to get for that premium that I pay? Some of that administrative support that comes along with it. So stay tuned on that, because you're going to want to have those conversations either with your broker or with Emily. So you're going to want to start thinking about that now. There are grants available for small employers, so to offset the cost of this. So I talked about how for under 30, your premium could be adjusted. There are also some grants that are available. So for, let's say you have a disruption in your business because of people taking leave, the grant could cover some of the cost of that. It's not a ton of money, but it is something that's available for smaller organizations. By November 10th, so applying for these private plans will happen on a quarterly basis. So you'll have to fill out a waiver and pay a fee and request to go with an equivalent plan. And then that application process is going to happen 4 times a year. So there will be a window when you can submit an application. The window for a January 1 start has to be submitted by November 10th. Okay, so that's another milestone in your project plan. And then by December, I already said this, employee notifications have to go up. You're going to want to have your managers trained by that date and ready to roll on January 1. Any questions on the timeline, compliance and communication?
Do you know what the fee is?
Fee is how much?
$250 to waive the state plan. I believe that's annually.
Okay, so premium deductions begin in January. First premium, we covered this already. Next slide. So how we're helping companies, we're going through and we're helping to analyze kind of what your current employee situation is, what your policy situation is, really looking at the financial impact, helping to make a decision on whether we're going to go with the state plan, a private plan, or a self-funded plan. So self-funded plans are an option. And there are some additional requirements that go along if you're going to have a self-funded plan, like a surety bond is going to have to be put in place. But we're helping our clients kind of sort through all of this and do the initial analysis. And then when it comes to actually getting the plan in place, we're working with our clients on rationalizing all their policies, rewriting them as necessary, updating the handbook, creating training materials, and putting everything in place so that when time comes, you're ready to go. And then we're also looking at your tech system to make sure that it's capable of handling the tracking of all of this. So we'll look at whether it's ADP or whatever you have to make sure that the system has the functionality to do it. Not everybody's on ADP. There are a lot of payroll systems that don't have the functionality to do this. You're going to want to know that before you implement. So that's part of what we do with our clients. And then once you activate it, it's really working at it across the board, making sure that it works. You've got a checkpoint that we come in and we're dealing with all the manager and employee training issues. So this kind of lays out kind of a pathway. So you start with this analyze and plan, which I just was describing. You're going to pick one of these, and depending on which one you pick, there's going to be a roadmap within that you're going to have to follow to get it up and running. So if you're thinking about self-funded, that's going to be obviously the most complex approach, but it could be beneficial to you in the end. It gives you more control. But that's something that you're going to have to work through. And then it all converges back onto implementation, how do we put this in place with the broader organization. I'll turn it over to Emily. And I'll be back, sorry.
So again, I'm Emily Breitenfeld from Slate, and we're gonna talk about kind of some private plan considerations. I'm gonna go right to the next slide. This is a chart that I refer to often because this is so new for all of us, and how they calculate it is kind of mind-boggling. Like, you just listened to Steve's presentation, you still probably don't quite understand how it's all calculated. This is a chart that you can kind of refer to as time goes on. So the state is calculating, 88% of covered wages up to the Social Security wage gap, a wage cap. And of that, they expect, employers and employees to split the cost 50-50. So on this chart, it says 44% of their covered wages and or 0.44%, excuse me. And then employees are paying that other portion. And when Steve was talking about that reduced rate for employers, small employers under 30, what I wanted to point out that's kind of more evident on this chart is that the employees are still gonna be expected to pay kind of that same amount, the 0.44%. But if that reduced rate for the employer is there, that just applies to the employer portion, so it helps make it more affordable for the employer to actually provide this. And, if we do a private plan, if we're able to get rates that are better than the state rate, the reduction actually applies specifically to the employer, and the employee is still expected to pay the 0.44%. So it's a way to help employers, especially the small ones, to be able to do it. So when you're playing around with that calculator that's on the state website, it's kind of confusing because it shows the percentage that you would pay if we're just talking about the exact 50-50 split. But if there was like a little disclaimer on there that says like, but some employers might actually pay less than this because they might qualify for the reduction. So I guess the bottom line is, like, if you need help figuring that out, you can talk to Steve, you can talk to me, we can look at your actuals and help you figure that out. But this is a great chart to refer to, for kind of understanding that. Employers, as Steve had mentioned, can pay more than the 50% of the rate that you're seeing. We kind of are, in some ways, maybe recommending that you either keep it at like the half split, or you cover all of it, because it's going to be kind of a tracking nightmare to understand. Like, if you decide, oh, I'm going to pay 75% of what is going to be owed, the system is going to automatically default to a half split, and so you have to be kind of doing those calculations, and it's more of a administrative burden on your part to be doing that. And then if rates go up next year and you want to kind of keep your percentage or your contributions the same, there's just more math that kind of goes into it. So just something to consider. And then, so coordination with disability. Oh, yeah, perfect. So short-term disability plans, are typically for providing benefits when an employee has a non-occupational injury or illness that meets the definition of disability, including pregnancy and childbirth. But paid leave plans provide benefits when an employee experiences their medical condition, but they're not expected to meet the definition of disability. So, while benefits may be paid by both of the programs, if the employee does qualify for both, paid leave is not a replacement of your short-term disability, and short-term disability policies are not a replacement for paid leave. We've had a lot of employers ask, like, well, we have short-term disability, aren't we good? Like, that covers more than what paid leave covers. Can't we just do that? The answer is no. Like, the state is gonna make us do the paid leave part and participate in that program. And then we want the short-term disability policies to coordinate properly with what you have for paid leave, so that you're not over insuring or giving people more to stay home, basically. And a lot of your disability policies that you might already have in place are going to automatically adjust, like the carrier should know to automatically adjust some of your premiums. Like, you might actually pay less on your short-term disability policy to make up for what you're paying with the paid leave program as well. So that's just something, like Steve was saying, you really need to evaluate what you have for short-term disability and how that's gonna correspond with what else you have going on. And that's why I think the chart that's on this thing is super important to review as well, so you understand how you can kind of make them work simultaneously. So one example that I like to give is, you know, if you're taking paid leave, an employee might exhaust their paid leave for, say, the birth of a child, for example, and then, you know, they won't have any other ability to use more paid leave in that benefit year. So that's where short-term disability is also nice to have, because it's going to cover you for, you know, recurring things that actually qualify you under the definition of disability. When short-term disability and paid leave are both applicable, employers will need to review how their plans coordinate to determine how short-term disability and paid leave will coordinate. And if you're gonna use short-term disability to kind of top off what you have with paid leave. This is kind of similar to the way this is laid out. It's just another view of it, but you can kind of see how earned sick and safe time can be used, paid leave, some of the unpaid leaves, and then short-term disability, and how important it is to get them to work together. And then this is sort of repeating some of the information that Steve had, but state plan obviously is gonna be the default. If you do nothing, you're just gonna go into the state plan automatically, and they're gonna assume you're gonna pay half and the employees pay half. Private coverage is something that we can do if it makes sense, right? We obviously wouldn't recommend it if it wasn't gonna make sense for the business. We can run quotes and try to understand if we can find savings there. But it's maybe gonna be an even more interesting option come next year even. So when the state kind of has a year's worth of claims to look at, and they look at their rates and go, we have to increase this to cover all of the leaves that are being taken. So in year two, we kind of anticipate that the state rates will be more expensive. And so at that point, maybe the fully insured private plans will be even more attractive. I will say we've run a lot of quotes for our small business owners that we work with already. And the groups that are more than 50% female workforce are typically better off this year, at least with the state plan, just to give everybody that kind of information. And they're obviously, it's because the carriers are kind of looking at the actual census that we send, what the makeup of the group is, to say, how do we think they're going to utilize this? And so they're looking at, say, a group of, you know, 12 female employees that are in the age range to have kids, and they think, they're probably more likely to use their medical leave than this other group that might be more male, right? And so then they're rating some of the female groups a little bit higher, which I know is super unfortunate. Hate to say that, but that's just the reality of the private coverage. Whereas the state is just taking everybody in one big pool and rating it all the same, regardless of the actual census of the group. So anyhow, if private coverage was to make sense financially for a group, then we could do that. And then there's the self-funded option, which I don't know a ton about yet. We're still kind of working to find a surety bond agent that would be a good person to network with and provide more information at a seminar like this. So if anybody knows of anyone, feel free to let us know, because we would really like to talk to them. But from what I understand, with the self-insurance, you know, the employer is going to pay the premiums, but also pay the benefits. Whereas like if you go with the state, you know, they're reimbursing for the leave. So, more information to come on that. I can't really speak too much on that part, but that is an option. Next one. So why a standalone plan? Well, obviously the private coverage could be more interesting if the price is right. But there are some other administrative things too that kind of make it more attractive. You have the option to bundle your paid leave with some of your other benefits. However, we're kind of recommending that we do a standalone type coverage for paid leave if we go private, and that just gives us more flexibility later on to make changes if rates are doing this in different areas. We have the freedom to help you kind of switch things up as we need to. And then, you know, from an administrative perspective, as far as like the paying of claims and the dealing with the state, we know that the state isn't always great at being an insurance carrier, right? I became a health insurance agent right when the Affordable Care Act rolled out in 2013. Pharmacare, everybody remember that? And so I'm really familiar with how when states try to manage some of these things, how hard it can be at the beginning. And it gives me flashbacks to MNsure and sitting on the phone for hours waiting for answers to questions that nobody really knew. But we eventually like figured it out, and over time, you know, the program worked itself out, but you know, with a program like this, it just is hard for the state right away. So working with a carrier that's been doing it for a long time in other states, the administration is easier, the viewing of claims, viewing of where people are at in their leave process, is just a little bit easier from an employer view. But, you know, will the state option still be great for some groups? Yes, especially in the first year when their rates are what they are. And so we can always talk about that. So this is just a quick summary. I know Steve already had deadlines and stuff in his whole thing, but I like to see, I'm a visual person, so I like to see the timeline of it. So again, if we're gonna do private coverage, we would need to do it by November 10th if we are looking for a January 1st effective date. And if employers just do nothing and go on the state plan and then change their mind part way and decide they just really want to go private to make it easier, we can apply the next quarter and so on and so forth. From what I understand, you have to be on the private plan for a full year. So if you start it in April, you're on it through April of the next year. But yeah, quoting is happening now. And quite honestly, we get really busy in October working with our current clients, as you know, reviewing benefits, you know, for all of the benefits packages that we have. And so the sooner we can start doing some of these things and getting people's decisions made ahead of time for stuff like paid leave, the better that busy time will be. And so if that's of interest to you, you know, we have cards back there, I have information of how to start, you know, all kinds of group plans and information about Slate back there too. So feel free to take that. But this is just a good summary of all the different deadlines that are going to be coming up. And then next slide, this is just pictures of us. So for employees who are interested, or employers who are interested, this is who we are. Again, I'm Emily, one of the owners, and Melissa is the other owner of Slate. And then we have Lindsay, who does our benefits administration for all of our groups. She helps year round to help manage things like health insurance, dental, vision, disability. And then we're, of course, super excited to be working with Steve to figure out the paid leave portion of it and how that's going to coincide with everything else. Some groups might, you know, want help with the HR component and with the benefits administration component of it. And so maybe they need to work with both Steve and I. Some people just need Steve's help because they have one person in the office who's wearing 20 different hats and trying to do all of it at once. And that's great. If you already have a broker that you work with, Steve can work with anybody. Doesn't have to be, you know, set up with both of us. Or, you know, maybe you're comfortable with the HR part, but you've been doing benefits administration for a really long time without realizing that an agent could do it for free. So that's when you might want to work with Slate. And let's see, yeah, so our goal today was just kind of to bring education to the community and mostly helping, you know, with the discussion around these two things and how to prepare and how to help relieve some of the fear around the cost of it. And so with that, I think we've got some QR codes for if you wanted to look at the state website for more information. You can sign up on their website for updates too. So we have a QR code for that on here. You'll get this afterwards too, so you'll have the link. But I highly encourage you to sign up for the email updates because things are always changing. Like any kind of insurance or state-run program, like they're always coming out with new information. And I mean, even just this morning, Steve and I were trying to compile all the little facts that we literally got last night to put into this presentation. That's how new this is. So getting those updates regularly can be really, really helpful. So this is time for questions around this piece before we start with Dave's IRA mandate discussion. Does anybody want to ask questions, we can have Steve come back up too.
I have just one qualifying question.
Sure.
Or clarifying question.
Yeah,
So, we've been doing all of the things that you're talking about. So I
Great.
feel like we're on track.
Good.
But just to clarify, so if someone goes out to give birth and they have a child,
mhm,
that they could essentially take a full 20 weeks because 8 of those weeks could be the medical leave and then the bonding leave
right,
falls under. Okay.
yep.
So, and we are predominantly female.
Mhm,
Yeah, so we've gotten quotes from our disability carrier for
Great.
all of it. It's astronomical though. the
yeah,
cost
okay, to bundle it,
To bundle it.
Sure,
And have,
yep.
yeah, it's,
Mhm.
it's,
it can be, yeah.
it's very expensive. Okay.
Yeah, and so you don't have to bundle it.
Mhm.
You can go with the state plan for paid
Right.
leave and do disability through the carriers. If you're doing short-term disability and you're trying to make it like a benefit that's employer paid, typically the rates are gonna be better for that than if you're making it like a voluntary benefit where you make the employees pay for it.
Okay.
And you have like certain minimums you have to meet, and those plans tend to be more expensive.
Yeah, and our short-term disability plan is fully funded by the employer
Okay, yep,
right now.
yep.
But
So you should see a reduction on your premiums for the short-term disability part of it, because they know that some of this is gonna be covered by
Right.
paid leave. But yeah, definitely it's worth, ask if you have a broker that you work with, ask them to look for other options besides just bundling it, because sometimes that's not the most cost-effective way to do it. Sometimes it might be, but this is also new, that is worth like looking at everything from the beginning. And then you can always change later on, if after a year you have one thing and you wanna review it the following year, you'll be able to do that.
thank you.
Yeah, that was kind of a long answer, but hopefully that helped.
So thank you.
Yeah. Anybody else? Questions for Steve too? Cause, yeah,
What is the waiting period? So on January 1st or 2nd, someone could take
leave immediately.
the leave immediately, right?
If they
How
have.
is the state going to pay that? Or have they?
So, Steve, maybe you wanna talk about sit out?
Well, they'll have to, have to pay it out of reserve funds or whatever, I mean.
Yeah, they have reserve funds to pay.
Until the funds come in through the quarterly, the tax basis. I'm not sure how functionally it's gonna work, but they'll be entitled to pay, that day one.
Because it's not like Minnesota unemployment where when you have employees that collect, your rate goes up.
Mhm.
So this, everyone pays the same rate,
Everybody pays the same.
whether or not their employees take it.
Yep. The only thing that will change it will be adjustments to the average weekly wage. And they may adjust the premium to make sure that they're keeping up with what people are taking. So those will be the things that will drive adjustments.
And it will adjust for everybody, not just for
Yep.
folks who have people who take it, yeah.
Emily, I have a quick question.
Yeah.
So we have like 5 remote workers that are never in Minnesota. So if I'm understanding the law correctly, they wouldn't qualify for this at all.
Correct.
That's what I thought.
They'd have to
I
be
wanted to make
working
sure on that.
Within the boundaries of the state of Minnesota.
Yeah. Okay.
But as I understand it, if they don't work in any state for more than, what was your slide? It was-
Oh, yeah,
If they don't work in any state for more than 55% of the time,
50%.
50% of the time,
Yeah.
thank you. Then they kind of look at where they reside to determine.
Yeah.
Which state they qualify. So you're saying you have people that don't work here at all, that's fine.
Correct.
But if there's somebody that has employees who kind of live here, but work in different, companies.
Yep.
Yeah.
You have a question?
Yes, so like. Short-term disability, FMLA, they all have a period to have a decision being made on the claim.
Yeah.
What is the waiting period for an employee who wants to go on a 20-week leave?
It's a great question.
How fast they're gonna get an answer, and for us as an employer, how fast we need to grant that leave.
I don't know how fast they're gonna issue answers. I can't answer that. But it'll be coming from the state. I think the private providers might have more of a specific time frame in terms of service level of when they get a response.
All we've heard so far is that when from the carriers that we work with that have been doing this in other states for a long time, what they say is typically the insurance carriers that are in the private market pay faster than the state. Which doesn't surprise anyone, right? The state's probably gonna be a little slower, especially at first with figuring all of this out and knowing how to pay claims, so. Yeah, that's one of the big benefits to going private, but, you know, obviously if the state plan is less expensive, I feel like most people will probably go that route at least for the first year, but knowing that like. The waiting period might be longer, but they have not said specific amount of days in which they expect it to be paid.
Yeah, I mean, I'm not overly concerned with the paid part because they eventually will get it, even with some carriers in short-term disability. That comes, 2-3 weeks later, as long as they get it, they get it.
Yeah.
My concern is they're requesting a leave. How fast is that, and is that leave going to be approved by the state? Therefore, we can grant it to the employee, or it's simply a given, like the Minnesota Sick and Save, like, hey, I'm out for the rest of the afternoon. I think I need to take the rest of the day, and you cannot do anything. So it's kind of what my concern is, how we employers can have a safety net of this is what the usual process look like.
And be able to manage your staff.
Yeah.
Do I need to get somebody else in here ASAP trained because I know this person is gonna be gone for 20 weeks?
Yeah, do you know what requirements they're gonna have for proof that you are essentially eligible for?
For a medical condition, it will be from a medical provider. For other situations, they'll have to have documentation from a service provider is what I read. So a service provider might be a social worker, it could be a case manager, that sort of thing, attesting to that their personal situation requires that. So if it's military leave, it could be somebody from the VA or that sort of thing. So there's some form of documentation is required for any request for leave, and then the decision will be based off of that. Yeah.
On the town operational strain of things. If we have the person as specific, do your task, and they take the full 20 weeks and they're gone, and we need to replace them to have somebody to fill that. And they have to have their job available to them when they come back, we just throw the other one away.
That is such a good scenario question, and it's one that Melissa and I have been talking about for quite a while, that it's like. Yeah, when you have a really specialized worker who, it's really hard to not have that person there, or they're on your sales team and they're the person that brings in new business, and how do you run your business when you are. You don't have them for 20 weeks, that is a tricky thing, and I think the grants that you mentioned about, from the state that help people. Afford to have temporary work while they're gone is maybe the biggest part that could help with that. But do you have other things to say about that? Cause that part is something that I'm still trying to understand.
I mean, that is the implication of this. Good, because they're entitled to have their job back when they come back, or equivalent position.
But if you terminate the temporary employee, you're gonna be on the hook for their unemployment, then when you terminate them, don't.
Yeah.
So the grant is really nothing, because the unemployment hit's gonna be bigger than.
Yeah.
When you calculate tracking all of this, the cost of taking term, and even just writing the policy and checking into it.
Yeah.
And all the fine work that you're doing. Calculate that with how to track sales and use tax across every different county in this place. Why would anybody run a business in Minnesota? Sorry. It's a thing. So I thought I'd just share that.
Yeah, I don't think you're alone in that, yeah.
So I have a question. So you have an employee that takes 10 weeks. They take their 10 weeks. They receive their income from the state of Minnesota, correct? They'll get paid from the state of Minnesota. But as the employer, you are then required to take that and pay all of their taxes out of that, correct? You are on the hook as the employer to pay those taxes from their state check. How do you get that information of what they're receiving? So that you know what to pay.
I'm not sure what the reporting flow is from the state to the individual business. I'll take that back and try to get a response back to everybody when you get the slides.
Yeah, and this is why Linda and I had really wanted to bring someone from the state to do a talk too, but they're done with their roadshow, so. The biggest thing I can recommend is to keep watching the state webinars and ask those questions to them because they keep on adding.
Yeah, because they don't answer them.
In the, do you do the webinars and ask the question there? Or
I
you
have
just send them an email?
specifically asked, I've done the webinars, but I haven't asked that.
I would totally ask because, you know, they take those questions at the end, they try to answer what they can, and then a lot of times they update their next webinar with answers to those types of questions, which is super helpful for everybody. Like, we are all asking those questions.
I do have direct connections with Deed also. If there are questions that you're needing answered and you're not getting a response to, I will make sure, ask me for one of my cards, send me those questions, and I will reach out to Deed and try and get answers to those questions directly. And also send out an email to people that are looking for answers. So if you need anything that you're not getting directly from Deed, do not hesitate to reach out to me as well. I will get the answers for you. And I am not afraid to pick up the phone and call them directly, so.
Yeah,
Yeah.
so this kind of goes with Steve, one of the webinars I had seen. A question was asked, okay, I have an employee out now for the 12, maybe 20 weeks. They are paying for their health insurance through their payroll. How am I going to get the money from them?
Good question.
And basically the response was, that's gonna be based on what policies and procedures you as an employer put in your handbook.
Thank you. I had that in one of my slides.
So
I forgot.
that was like a big light bulb for me when I watched that webinar earlier this week, because I didn't think about that. And why are they out is because medical, they need their health insurance. They can't get that rejected because then they're probably even more deep than what they were to begin with.
Yeah.
So that was something that I was just like, wow, that hit me really hard. Like, oh, I didn't think about that aspect of it too. Like, how are you gonna receive that payment from the employee to cover their health care?
Yeah, that's kind of a part of the whole thing that Steve was talking about with getting your handbooks all updated, is to make sure that you outline in there, how are they going to reimburse you for their portion of their benefits while they're out, if they don't have a paycheck to pull from because they're not working. What, how are you gonna, do you want them to send you a check? Do you want to double up on, you know, payroll deductions when they're back? Or can you, if it's a planned thing, can you do it before they leave? Can you double up on some of those payroll withholdings to cover it, knowing that they're gonna be out? You know, a planned birth is maybe one, that's an easy example of, like, you could maybe get that ahead of time, figured out ahead of time, but then there are things that just come up that you can't plan for too, so that's where that is tricky, and you definitely want your handbook updated. Maybe you have more to add to that.
No, I just texted my expert to see if she can give me an answer before we end the sessions.
Okay.
Read it.
Good question.
Yeah.
What about like seasonal employees? Like, let's say they work all summer and then at the end of every season, they go out with the medical. And they get their 12 weeks.
There were
They're
some-
not going back. Or
Yeah.
It was for scheduled, like they only were supposed to work for 16 weeks or something.
Yeah, Steve, you had something in your slide about the exemption for seasonal temporary. Can you talk a little bit about, I know there's like a very small seasonal exemption for businesses that have seasonal employees.
We go back to the slide,
I think it's
150 days.
in a calendar.
Yeah. That sounds right.
150 days per year.
Oh, that they had to have one.
Those employed for no more than 150 days in a consecutive 52-week period in a hospitality industry specifically are not eligible, but I think that's just the hospitality industry, right? I've done the state webinars and they're very narrow on their definition of who's exempt, so tell me your question again.
So I'm just thinking like, say you hire somebody for the summer, or I mean, any industry, like say construction, you work for the summer season.
Yep.
You're laid off the same time every year, but then every end of the year you have mental health issues or, you know, something to get those 12 weeks of paid. I mean, and then the plan is never to go back to that role, or
Right.
like, what if they had a defined time period, like they were supposed to work like May through November only? 6 months or something.
So you're saying at the very end of their contract, they would
They take this, yeah, it's
Or
not-
even like college interns,
yeah, or that, well, that's where I was kind of thinking about it, but.
yeah, we hire a lot of college interns.
Yeah,
Where they just work very part-time, or they might work full.
let's follow up with everybody on that one too.
Yep. Right.
Yeah. Yep, we'll get your answers on that. Like I said, this is also new and things are changing so often with the communication that we get that we don't have all of the answers, but that's why we're doing this, so that we can gather the questions and make sure we get the answers, and then if we do this again, we'll include the answers to those things in our presentations. So thanks for asking the tough questions, yeah.
So I'll just give you a couple minute update on the health plan fiduciary responsibility. So the Consolidated Appropriations Act of 2020 made it so that the federal government is going to enforce fiduciary responsibility for health plans. So what this means is what they're trying to do is get more market forces into the healthcare system. And there are a lot of issues around pharmacy benefit manager organizations and the money that flows behind the scenes between the plan sponsors, pay these premiums, and then what gets paid to the pharmacy benefits organizations. There's issues around broker compensation mainly for 100+ live plans. And one study that was done, they looked at the variation between the compensation that went to the broker in looking at the 5,500 forms. And it was a huge swing. There were some brokers in that large employer category that were receiving lots and lots of money that doesn't necessarily show up on the paperwork that gets put in front of you when you're renewing your plan. So everybody's familiar with the PEPM, but there can be fees in the background that are getting paid, incentives, overrides, and bonuses that get paid within this system. And that's what they're trying to bring more clarity to, so that they can use the market to force better value for health plans. So what this means is that, so let's say an employee has a problem, they get a claim denied, and they start to look at the plan that was put together by the employer, and they talk to a lawyer. The lawyer could start to look at this and say, well, they didn't fulfill their fiduciary responsibility as a health plan sponsor in setting up this program on behalf of employees. That's the implication of it. So what's starting to happen is that lawsuits are starting to happen where they are taking Blue Cross Blue Shield was sued. The lawsuit was dismissed, but not on the grounds that were presented around the fiduciary responsibility. It was on something else. So the point is, it's taken a few years for this to gain traction, but what it means for you is that you have a duty now as an employer, a fiduciary duty over your health plan. And so that means that the directors and officers of the business are personally liable as a fiduciary for things that go awry under this setup. So it's very similar to what was set up for retirement plans under ERISA is now being applied to health plans. So what you can do is, what we're talking to our clients about is a fiduciary process that's going to give them a defensible position. And there are steps that you can take as you're going through the renewal process, or if you're working with a new broker and a new health plan provider, to take certain steps to make sure that you're doing your applying a fiduciary process to this situation. Basically, you have to be able to say that your health plan spend is reasonable. And again, that's the visibility that they want to start to force into the system, that reasonableness starts to take hold. So what that means is going to be obviously hashed out. This is less so in the case in the small employer end of the market, but you can't think that you don't have to do anything. So even small employers who are on fully insured plans have to take certain steps to fully avoid the liability that comes with this rule being in place. So we've got Transparency and Coverage Act that's part of this. We've got Hospital Transparency Act, and then the Consolidated Appropriations Act is where this came in. So there's 4 key provisions in there. Remove gag clauses from all contracts. So that has to be removed, and that's something that your broker should be able to attest that they've done. there's required disclosure of all compensation. So it's not just the PEPM that you see, but all bonuses, overrides, and other forms of compensation are revealed. And then there's also required clarity on substance use and mental health benefits and prescription drug disclosures. So nobody's really talking about this. We're probably the only one. And in some ways, I think small employers are saying, well, I don't have to worry about that. The issue comes in the fact that if you get audited and they come in and they start asking questions, and you can't produce evidence that you went through a thoughtful process in renewing your health plan, they could find you in violation of the rules. So that's kind of the implications of this website. So anyone who has decision-making power over the plan, so that's what I was talking about, those people are going to be held personally responsible for this. This includes HR, finance, and executive roles in the organization. And your duty is to act in your employees' best interest. So that's the standard that's being applied. Next slide. We already talked about this. Essentially, for probably the people in this room, Emily said something really that was key just a minute ago. She said, you may be administering benefits, but you could have somebody on our team do it for free. That's an example of a service that's being provided by a broker that would be seen as something that is a better value for your employees. There are lots of players in this system who are very passive. They collect money and they really don't do anything. And so this whole structure is intended to force people to demonstrate the value of what they're doing. So, people that show up once a year at renewal time, they're not providing any support in between. They're probably more at risk in this sort of a scenario because employers are going to start to ask questions. Well, okay, so you're receiving this compensation from us. Is it reasonable? I know these people over here who deliver a much higher standard of service to our clients. Why aren't you providing that same level of standard of service? So it's going to start to bring those questions forward, which is where, as an employer, as a health plan sponsor, you're now meeting your fiduciary duty if you're asking those sorts of questions. Next question. So I'm not going to go over these because we're short of time, but this is in the slides. What does it mean? So you've got 5 duties that are listed out in here: duty of loyalty, and on down to this. You can read those at your leisure. Let's go through the slides real quick. Prudent expert rule. Follow the plan documents. You got to do what your plan says it's going to do. So we've created a toolkit that will help employers follow a process that will make sure that they adhere to that fiduciary duty that they have as they go through renewal going into the fall. So that's something that we can help with. We're working with our clients on that as they're going into renewal season. And so we're going through a process of vetting brokers right now to make sure that they're competing to bring the best value to the table. And so participating in that will, the companies that we're working with will be able to kind of check that box and make sure that they can defend themselves if they ever get in a situation where an audit happens or an employee files a lawsuit. So that's a really quick dip in that topic. So if you want to talk more about it, I've got my business cards. You can always give me a call and be happy to share more information. So I want to make sure that Dave has his time.
Good afternoon. Are we feeling good? Everybody excited to be a business owner in Minnesota? I am. Well, buckle up. Has anybody heard of the Minnesota Secure Choice Retirement Mandate? Show of hands. All right, a little bit. Back in May 18th, 2023 is when this law actually went into was actually passed. It states that any company that has 5 or more W-2 employees must offer retirement access to its employees. Does not matter if the employee is full-time or part-time or temp, seasonal. If you're paying them a W-2, they're counted in the census of the company. It goes into effect, this just got updated, it's gonna go into effect first quarter of this next year. So sometime between January 1st and May 31st, We're hoping at their next meeting that they'll have this tightened up and we'll have an actual start date. So we do know that the businesses are going to have a 2-year enrollment period, which is nice. They're starting with the largest businesses first and then rolling down into the smaller businesses. So if your business is closer to 5 W-2 employees, you'll have a little bit more time. If you're closer to the other end, it will start actually pretty close to the start date that Minnesota's rolling out. Again, who needs to comply? All businesses with W-2 employees ages 18 and up. And if they're part-time, then again, they would also be in there. Employers in the state program will not be allowed to contribute for the type of program that they're opening up. We'll go over that in a second. I get this a lot. What if none of my employees want to participate? Do I have to do anything? And the answer is yes. So if you got 5 folks in your company and nobody wants to do anything, and you're not going to bring on a private plan, you would still have to enroll in the state plan and opt everybody out of the plan. Not how that goes. Penalties for not complying. Penalties for the first year, and this is really nice. We've been following pretty closely Illinois' program. In the Illinois program, the fines accumulate quite quickly. Minnesota is waiving the fines for the first year. You'll get some nasty grams from the state. If you're not complying, you'll get several very nice not letters saying you need to comply. Year 2 is when they start the fees for compliance. So if you don't have everybody opted in on the program, they're going to hit you for that. And then from any of the disclosures that you're required to give in the timelines, if you hit that, what they do is they double the fines. It's based per employee. So they can get up there quite quickly. If you're in year 5, you can be up to $1,000 per employee per year for the fine. So they can get up really quick. How's the state going to mandate it? How are they going to audit? There'll be several different ways that they're doing it. Nothing is set in stone right now. They can run it through payroll, can run it through, they can just stop out. So there's going to be this over the next couple of years. They could just do random audits of the business. It could be an email that shows up in your inbox and says, hey, show us this information. If you are audited on site, you have to be able to produce, if somebody has an opt-out form, you have to be able to produce those forms that employees have opted out. So make sure you have good HR folders and everything that is filed in there, because likely you will be needing them in the future. And this map shows all of the states currently that have some sort of program that's running. So the darker blue are states that are about 2 years ahead of us on the mandates. So the legislation's passed, everything's gone into place. The darker green, like Minnesota, those are states, we have 8 of them, that are in the same process that we have. So legislation has been passed and they're just working on the implementation period. The light green, it's legislation has been presented, it just hasn't been passed yet. And then South Dakota and I think Georgia are the only 2 that haven't done anything as of yet. You're going to have some options that are available for you. There'll be a state option, a private option, and my favorite, the Consulting Plus option. Does that work? So in the state options, take a quick look at that. So the state is going to default directly to a Roth IRA. I was studying yesterday on some of the stuff and I was interested, why are they going Roth? Why are they going Roth? That just seems kind of weird. My background's banking. I was in banking for 30 years. I owned a couple businesses, sold some businesses. It's usually it goes into a traditional IRA and people are taking the save the taxes up front. So how the opt-out forms work with the state program is you have to give the notice 30 days prior to that first paycheck. So if you were to hire somebody that's just say August 4th, in a week or so, their first paycheck, if you're doing a bi-weekly, would be the 22nd. That 22nd is not within that 30-day time frame to give the employee time enough to opt out. So pretty much everybody, whether they're gonna be in or out, if you're gonna go the state route, you have to put everybody into the state program to be compliant. Even if the employee doesn't want to be in the state program. The next pay period, if it's within that 30 days, they could opt out. You would not have to have them in there. The employee then would have to try and get a refund from the state to get their money back out of their IRA account. Isn't that fun? I just tried to answer it. I'm like, wait a minute, what? The only other way around that is if you were to give them the opt-out form, what would it be, July 23rd, which you hadn't hired them yet, which you can't do. Another option that you could do would be to push their first pay period a month out, which I don't know how many employees you have that you just hired that are like, it's all right, pay me next month, I'm good. So there's some complexities kind of inside of that. So the default rate that it's gonna start at 5%. Again, it automatically goes to the Roth. If an employee wants to change from a Roth to a traditional, they'll need to log in the account to make that switch. Every year it goes up 1% with a maximum of 15%. So if you're in the state program and your employees don't want to contribute more than the 5%, or they want to contribute less than 5%, that's fine. It's just whatever percentage they pick, it's gonna automatically go up 1%. So if they just want to stay level, they'll have to sign in and make that change. And then the asset type that they are going to be in, it's just your traditional IRA or Roth with the traditional funding amount. So just like years ago, when I was a young baker and Sally would come in to make her yearly contribution, that's essentially what the state program is doing. So it's just a traditional IRA, the maximums of 7,000. If you're a 50-year-old person, you could put up to 8,000 of that, and that's across the board. That includes the business owner as well, if you're doing the state program. So the nice thing about the state program is there's no fee for it. So for the first time that you've heard today, there's no fee for that portion. That's the one thing they do like on the state program. You are required though to administer the program. So the administrative tasks, any change contribution amounts, updating the opt-out forms, filing the contribution sets with the state. So managing all changes, so address changes, email changes, contact information, that'll be done. Pulling the funds and having mechanisms to pull the funds out of the employee's paycheck, have that deposited into an asset or a trust account, and then being deposited and filed to the state so they can be put in the employee's proper investment accounts that the employees will choose. So that'll be managed by the business owner or somebody in the company. So again, no monthly charge on that. So essentially the state isn't going to charge you for running their program. Is kind of how I get it. There will be an asset management fee. It's not totally set in stone yet. It's typically going to be anywhere from 0.5 point to 1% that the employee would pay. Just like if anybody has a 401k now, there's an asset management fee to actually run the 401k piece of it. Same thing will apply here. Average time a week. This one is up. I'll get you the updated one. That is actually wrong. They're gonna spend about 75 hours per year managing the account. That's what we've seen from California, Washington, Oregon. There's a number of states that are out there that have already kind of put these programs together. So figure about a half hour per week at $25 an hour, it's gonna be 150, 160 in man hours to produce. So don't forget, it's up on that slide, I apologize. So for the private option would be your second option. In the private option, what people are doing is they're doing just straight up 401ks. Private option is one that I like better. You get better retention, better satisfaction, and lower turnover rate, especially if the employer's doing a match on that. The other thing that I like as opposed to the state program is through the Secure 2.0 Act. They passed up to $16,500. So any business that's starting a new 401k plan can get up to $5,500 per year to offset any of their costs of starting up a 401k plan. Where the state plan, because they don't charge a fee, your labor isn't qualified for the tax deductions. In a private plan, the hard costs, you can apply for tax credits from them. It's Form 8881. You can talk to your CPA and they should know all about it. So they're fantastic. So the major advantage between the private options and what the state is offering is the ability to contribute way more money into the account. And for business owners, work with your CPAs and you'll find some tremendous tax advantages that you wouldn't be able to do on the state program. So on a private program, you can be $23,500 annually, and if you're a 50-year-old, you can put in another $7,500 to that. So for business owners, it's a great way to really kind of maximize retirement and lower taxable income here. So typically on a private program, what happens is, and the reason why I call it a private program is we now have a state program. So the private program is just simply what we used to do before the state mandated it. So you go to your investment bank, it could be Wells Fargo, US Bank, Voya, Polaris, whomever. And you'll set up an account with them, a 401k account, and there'll be what's called a 338 fiduciary. So they handle all of the investment side of it. They do non-discriminatory testing on it and make sure that everything is compliant on that side. On the business end, or the plan sponsor, there's all of the compliance side of it. So business owners can choose to take that on themselves. So these would be the administrative tasks up on the board. I won't read them individually to you. That the business owner would be subject to. So there's a couple ways that they can handle it. The business owners can dive in themselves and figure that out, or they can actually work with what's called a TPA, a third-party administrator. Would be another company that you would hire that would handle kind of the day-to-day tactical stuff on the 401k. On average, just so we can kind of keep the fees together here, for the bank fiduciary, so the investment side, a business can expect to spend about $250 a month. That's to do the investment, make the investments, send out all of the statements that are required to go out on that, non-discriminatory testing. If the business owner doesn't want to do all the tactical aspects of it, they would hire that third-party administrator, and depending on how much work they want that third-party administrator doing on it, it's going to be, somewhere typically around 350. So on average, you put the two together, you're going to be somewhere mid-fives, depending on the size of your company. Again, the higher the company, the fees will go up a little bit, but not too bad. The business owner on this, there's a form, it's called the 5500 form. That's kind of a big tax form for these types of programs. It's typically, I shouldn't say typically, it's signed by the business owner. So it goes over the entire year's census, who's taken out loans against it, what your employee start was, how many have come on the plan and off the plan throughout the year. Is anybody taking early distributions on it? It's quite an in-depth form. Typically, your TPA would go ahead and fill that out for you. Needs to be filed with the Department of Labor every year to be done. The fines that can come with this, if it's not done properly, can get quite large. $8,000 plus on some of these. And then in this case, the business owner would sign that form. Who signs the form, owns the form, they pay the fine. There's a fine.
For private options, can they do like a Roth or a supplier?
Yep.
For product?
Yep. So wide variety of products, they can do whatever they want. Typically they can split. So if they do 50% in Roth, 50% in traditional. Index funds.
What about a simple IRA?
Simple would be different.
That wouldn't qualify?
That wouldn't qualify in principle. So, the simple plan, the SEP, the KEO would all qualify for the mandate. So the state mandate just says that an employee has to have access to a retirement program, so simple would qualify for that. In that scenario, and it has to be automatically deducted out of their check. So it's just 2 cents of that. So does that make sense?
So do we have to do that opt-out option if we've got one of those retirement plans?
If you already have a retirement plan, you're done.
Oh,
So the state will probably say, hey, you need to send us plan documents or whatever they deem necessary for that, but if you're there, you're done. You don't have to worry all about the state. Next option.
Dave,
Yes.
a lot of times like 401ks will have a waiting period. Is the state plan, they're eligible right away?
They're eligible right away.
Yeah.
So as soon as you hire them, as the employer, you need to enroll them into the state program. If they want to opt out, they can sign the opt-out form, but they're still gonna get on that. Yes,
If you have a waiting period, so if the employee is going to the state during that waiting period,
in the state program, there is no,
no, if you have a private plan, that
Yep.
waiting period.
you're fine. If you have a private plan.
Okay, so it's in place.
Yeah. If you have a private plan of any kind, it could be a pension. And if you have a private plan of any kind, you're safe on the state program. So the one thing, each one second, the one thing I would caution you on a private plan, I was working with a company in St. Cloud, they have a pension for everybody. To qualify though for the pension, you have to work 1,000 hours. You have 4 employees that don't work 1,000 hours. They have to provide something to those 4 employees, even though they have a pension. So you just have to look at, if you already have a retirement program of somebody, it just has to be accessible to everybody. So that means if you have any qualifiers in there for a W-2 employee that has hit a certain amount of hours or certain amount of time, certainly beyond 6 months, that individual, you would need something for them. Does that make sense?
You're saying they have to, like, if they don't wanna have to do the state, they should adjust the eligibility requirements of their private plan in order to make sure everyone.
Yeah, and sometimes you can do that, sometimes you can't.
Yeah.
It depends on the documents of that particular plan, and you have to make modifiers to it. With this pension, they can't with how it was set up. So we're actually doing something that's gonna cover the entire company and for employees.
Clarify that.
Yes, second.
If we hire a new person and we have a plan, benefits plan package. If they're not vetted for 6 months or a year to be eligible, still have to offer the state plan or they opt out of state plan and.
You still have to enroll in the state plan. They can opt out, but you'll still have to enroll in the state plan.
Unless you just, yeah, when they're hired and get the benefits immediately, that's owed to them, there's not a benefit period. Okay, that's done.
But once you're in the state plan, now you're with all the disclosures and everything that are the state. So, okay, so my favorite option, is the Constellium Plus option. So my previous company that I had, we were looking at this, ran through the private, brought that on. When I sold that company and I was talking to one of my business advisors and learned about the Minnesota retirement program just over 1.5 years ago, was kind of dumbfounded by it. I went, oh my gosh, this is kind of crazy. I wanted to develop something that I would do as to bring onto my company. I didn't want it to be expensive. I don't want to do it. I don't want to spend any time doing it. I'm gonna treat it kind of like my payroll when I brought a payroll company in and just said, just tell me how much to put in the payroll account and send me the payroll reports. That's how involved I want to be. So that's the program that I developed here. So with the Consilium Plus solution, we integrate with over 500 payroll companies. All the information comes in actually through payroll. The employees have a really mobile friendly device, so they can just sit on their phone. If they want to change their contribution rates, they can just pull it up, change their contribution rates. That automatically links in through our solution and then shoots it out to payroll. So nobody even needs to call payroll. It's just all automatic through API. We maintain all the deduction. Our solution does all the legal disclosures on it. The non-discriminatory testing, and then since we're doing all of the work in our solution, the 5500 is signed on the employer's behalf and is automatically filed, which means again, who signs it owns it. So that's some liability of the employers. Consilium charges a one-time $3,500 fee. It's kind of a white glove service. Our company comes in and we do the training, financial education, and onboarding of all the employees. We'll work with HR person or the business owner. And if they want to learn the back room system, the website's super easy to do. We have third-party admin rights on the back. So if an employee is getting terminated, had one of my accounts call me the other day. They were terminating an employee. And they actually said, how do I do it? I'm like, do you want me to do it? Or do you want me to show you how to do it? Said, I just want to see it. We jumped in within 2 minutes. It was done. And she's like, I'll send the next one to you if I need to do it. It takes 2 seconds for us to do it. So putting an employee on, taking an employee off, terminating them, all of the disclosures are handled through there. The other nice thing is if an employee moves or changes an address, or an email address, the employee has the ability just to go into their own system and change their contact information. So it doesn't, in the old system that I had, it doesn't have to go from the employee to one of my managers and up to me to payroll. And hope to God nobody transposed the numbers. Mostly me because I have dyslexia. Well, that would have been me. The monthly fee is $160 per month. The flat fee, that's the only fee that's ever charged. Then it's $7 per W-2 employee. And then all of the fees are covered under the tax credit. So at the end of the year, we then prepare the 8881 form on the business's behalf and then send it to your accountant for their, so it's super easy to do. When Consilium comes in and does the onboarding and the training and the education, we find that we get a 40 to 50% higher participation rate than if the employer tries to do it themselves. I'm amazed at the meetings that I've done with the employees that they think that the employer is going to steal their money sometime. So, or what is it a 401k and why did they call it a 401k? That's the tax line. It's 401 subsection K. And I'm like, wow, that's cool. And then Consilium is with the business owner throughout. So it's a one-time fee. If you're with our solution for 15 years, it's just one-time fee. We're a business consulting firm, so we bring in folks like Slate and Steve Shad with Optima to help solve the FMLA and everything else that's going on with business owners. So we like to partner with those guys to kind of bring everything under one roof. And we like to make our solution. You guys have a tough enough job doing whatever businesses that you guys are currently doing. So we want to make the compliance stuff and just kind of take it off your probation. So That's a new mandate. It's coming down the pipe very, very quickly. The one last thing that I will give you, roll out of here, is everybody thinks, okay, we have 2 years, we have all the time in the world to have this stuff. So let me give you the lay of the land a little bit here. In Minnesota, we put together about 470 plans per year. And we've done that consistently for about 20 years, sometimes a little lower, sometimes a little higher, but 470 is about the plan. That's what Minnesota has the infrastructure to put on. This mandate is gonna necessitate 48,000 businesses that need to do something. And there's just not the capacity to do that. Moreover, nobody likes startup plans. If you're just starting up a plant, there's no bank that likes you, sorry to say. There's no financial planner that likes you, again, sorry to say, they just don't. And the reason is they're paid off the asset. And when you start up a plan, there are $0 in the asset. That's true for the banks, ran them. It's true for their financial planners, work with many of them. They just don't want the business. In our solution, we've just figured out how to make those low profitable businesses, and that's what a startup plan is. There's just very little profit into it, profitable. And basically it's through technology. So we don't have all of the overlays that other businesses and financial institutions have. So for us, we can make it very profitable. Keep in mind, for a plan to become profitable for a bank or for a financial planner, they need $1 million in that asset for it to be worth essentially their time. You typically get paid 50 basis points on the back, so $1 million, that's 5,000. So a bank would look at it and go, okay, we can grow that. Or a financial planner would look at it and go, okay, I can do that. If you're starting up a plan with 5 employees, 3 of them are part-time, it may take 20 years to get that thing up and running. The average lifespan from 0 to $1 million currently is about 7 years to get that up to it, but the size companies are typically 100 plus. They're typically professional, full-time salaried folks. Now with this new mandate that's coming down the pipe, it's pretty much everybody is going to need to offer something. So if you're looking at doing something, now's the time to do it if you don't want to be in the state plan. So, okay, I'm free. That's it. Any questions? All right. Well, thank you guys for coming.
Thank you. Thank you. Linda, Melissa, thank you for helping today, coming early and helping assist Melissa grabbing the food. We appreciate our chambers for, helping share and spread the word. Thank you for speakers coming today. Great event. All I have to say is please leave your name tags at the desk as you walk out. And if you guys have any questions, don't hesitate to reach out to myself or any of the speakers. And we appreciate you coming. We know it went over, so I won't take any more of your time. Have a good rest of the week.